healthcare deserts are expanding. In Minnesota, we see a different trend. Statewide STI rates declined 5% in 2022 compared with 2021, and Minnesota's infant mortality rate also decreased. But unacceptable and preventable disparities continue. While maternal mortality is lower in Minnesota than the national average, there are still stark disparities for Black and Indigenous Minnesotans. For every maternal mortality, there are about 100 morbidity events, or the near misses, where someone almost dies from a pregnancy-related cause that disproportionately impact Black and Indigenous Minnesotans. We also see persistent infant mortality disparities for Black and Indigenous infants, and STI rates are not decreasing at equal rates across the state. Planned Parenthood is committed to building healthcare that meets the needs of communities that face the most significant barriers. Our Black and Indigenous neighbors, those living in rural communities that have to travel long distances for healthcare, and also people with low incomes. We know prior to the fall of Roe, healthcare access was not the same for everyone, and those inequities have only increased. We are continuing to work to bridge the gap for our patients. We moved locations in Mankato to expand our services, and we are launching medication abortion services this week at that location.
Great.
This improves abortion access and other reproductive health care services for southern Minnesota, and we are also investing deeply in telemedicine as well. As patients navigate a patchwork of regional laws on abortion access, we've expanded space and added staff for medication abortion at our Uptown Health Center. We're also looking at expanding our space and staff to increase abortion access at this location in Vandalia, contingent upon grant funding. We are providing care not only within this turbulent political environment, but while facing the same challenges that all healthcare providers and nonprofits are facing. As an essential and sometimes only provider to some communities, we are constantly navigating how to keep the lights on to continue to provide essential health care. We are thinking in new ways, not just at the services that we provide, but also working to break down barriers and build trust with our patients. It's going to take time and it's going to be a lot of work, but through it all, I have hope that we can create a world with better health outcomes, with better access to care, and I'm incredibly proud that Minnesota has started on that journey. Now I'd like to introduce my colleague, Dr. Sarah Traxler.
Thank you, Ruth, and thank you so much, Governor Walz and Lieutenant Governor Flanagan, for being here today. I'm Sarah Traxler. I am a proud abortion provider, and I'm the Chief Medical Officer at Planned Parenthood North Central States. When Roe was overturned, I knew that my exam room was going to get a lot more packed. I mean, it was packed before Roe was overturned. But even while we still had Roe, legislators in South Dakota and Iowa started inserting themselves into the decision-making process. Today, it has only gotten worse. I am no longer allowed to provide care in South Dakota, and I've started traveling to Nebraska in order to meet the needs there. I am so very grateful for our patient navigators who help patients from around our region gather resources to travel for abortion care. But I don't think any of us truly understand the journeys that patients go through to access basic care. Traveling to a large, unknown city can be intimidating and overwhelming. Like the experience of our patient who traveled from a small, rural town and became lost in downtown Minneapolis for about 2 hours with a dead cell phone. Thankfully, one of our navigators was able to get a Lyft driver for her to get her out of that situation, and that person was a lifesaver. And also like the experience of our patient who drove 800 miles in a blizzard across the Midwest, only to find that the weather here had caused us to shut down our health center for 2 days. She was forced to stay in a hotel for almost a week in order to access care. What many have failed to understand, and what we're finally seeing data reveal, is that banning abortion doesn't just stop abortion care. It harms everyone who needs sexual and reproductive health care. Abortion is a critical part of gynecologic health care, and in some places it determines how we treat people who have miscarriages and ectopic pregnancies. When I'm not allowed to provide abortion care as an OBGYN, I am not providing the full spectrum of care for my patients. My heart goes out to those providers in Idaho who are being forced to ignore medical emergencies and the medical needs of their patients due to an unjust law. This will have dangerous consequences. Healthcare decisions should not be made by politicians and judges, but by patients and their expert providers. As Ruth said, the patchwork of laws and access across the country and our region is changing the landscape around us for the worse. At Planned Parenthood, we are putting everything we have to improving care. We're looking at the upper Midwest around our region and expanding in critical areas to meet increasing patient needs. We set up our patient navigator program to help patients get to their appointments, which is increasingly getting patients across state lines. We are investing in LGBTQ plus care coordination as well as more state legislatures work to ban access to gender-affirming care using a very similar playbook. Life as an abortion provider has always looked different depending on where you live, but the contrast has only grown starker. This new reality is like a tale of two cities. Thankfully, providing abortion care has gotten less complicated in Minnesota. Here, I'm trusted as a provider and expert to work with my patients to provide the best care possible. To know that Governor Walz and Lieutenant Governor Flanagan trust me to do my job is a comfort, but that should be the standard everywhere. Private medical decisions should be made between their patients and their providers. Everyone has a right to health care. Your zip code nor your income should dictate the care you can access. So in 2024, we will continue to work to meet changing patient needs, continue to think creatively about how we can help more people in a more equitable way. There's a better world out there, and we're going to keep working until we live in a world where everyone can access the care they decide is best for their future and their bodies and their families in their own community. Thank you, Ash. Sending it to you.
Hi, my name is... Sorry. It's all good. I think I might need it. So hi, my name is Ash Farah. I'm the LGBT care coordinator manager here at Planned Parenthood North Central States. I absolutely love my job. Just like Dr. Traxler was mentioning, the navigators and care coordination really allows us to connect with our patients and help them in their times of need. Overturning Roe has fundamentally changed abortion access here in the United States, and only further politicized the care. What's been a decade-long playbook in banning abortion has been replicated in harming LGBTQ patients from accessing health care that they deserve. Thankfully, due to the leadership of lawmakers such as Lee Finke and the support of Governor Walz and Governor Flanagan, Minnesota has become a safe space for LGBTQ folk. The trans refugee bill has been a comfort for those seeking life-affirming care. I hear every day from patients that they're so lucky to be in this state, and I feel very lucky to call this my home too. But across the United States in 2023, over 500 bills were proposed in the legislature across the United States attacking the LGBT community in particular. These bills include banning transgender individuals from even using the bathroom that aligns with their own gender, bills mirroring Florida's Don't Say Gay Act, where they prohibited teachers from talking about LGBTQ identities and attacking gender-affirming care access as a whole. The healthcare system is complicated, and certain politicians purposely create a manufactured state of confusion to try to block people from accessing the care that they deserve. Like abortion bans, the goal of gender-affirming care bans is just simply to take away people's power over their own bodies and their own choices and their own ways to thrive for their own life. Gender-affirming care is life-saving care at the end of the day. Comprehensive gender-affirming care, supportive social and family environments for people to lead to better outcomes for gender-diverse teens, similar to their cisgender peers. Gender-affirming care is just that. affirming and supportive of patients' goals for their own life. And I'm so glad that here at Planned Parenthood, I get to facilitate conversations that allow people to find ways so they can thrive in their own bodies and see them holistically for who they are. My whole job is to connect folks every day with the tools and resources available to them to help them be themselves. Our talented team connects patients with resources in the community and with direct healthcare at our healthcare centers. We help patients navigate insurance, how to legally change their name and gender markers, find surgeons, provide information about transitioning, referrals for surgery, HIV prevention, and just so many other topics that fit under the umbrella of LGBTQ healthcare. And it's not just about getting them to their appointment. It's about helping the whole person, holistically. Managing the LGBT care coordination program here, I have a plethora of examples that prove that this holistic approach and this patient-first approach really gets to help people at the end of the day. For example, recently, there was an East African patient that I was helping assist that didn't know a lot of LGBTQ folks at all. So one, they were super glad to see someone who's also of that community representing and all the diversity here at Planned Parenthood. So they felt comfortable enough to share their story with me. And I helped them get out of an abusive situation, find housing with all the amazing resources we have here in Minnesota, get them into mental health therapy that they needed that was affirming and actually saw them for the individual that they were. And with all those in place, they are now in a healthy place to go to their appointments and actually receive the health care. Because when people come in the door, they come as their whole selves. They don't just come as patients. I'm talking to patients and parents who made the decision to move somewhere that is far more affirming for their healthcare needs and identity. They're looking to Minnesota because they need community and support that helps them thrive, and I'm very happy that my job just gets to be a great connector for those patients. And like Dr. Traxler was mentioning, Minnesota has become the safe haven state for folks to come in and get the care that they need. Lastly, I know why it's important to have gender-affirming care as a part of healthcare, because I too needed it. And that's why I'm proud to be a connector in the community, whether it's youth seeking a shelter that is LGBT friendly, teach people about HIV prevention, or to help patients know their rights within the legal system that is increasingly becoming hostile towards them. It's nice to have someone guide you and be there for you. I love what I do. I wouldn't trade it for the whole world. I think that patient navigation and LGBT care coordination is super important for our patients because you don't want to be alone during these rough times, accessing a very complicated healthcare system. Every day I get the privilege to remind folks that they aren't alone in navigating these complexities, and I hope in 2024 I continue to be able to help folks be their healthiest, thriving, best selves, and Planned Parenthood allows me to do that. Thank you. I'm going to pass it to Christy.
Thank you, Ash. Thank you.
Just a couple seconds, please. Thank you.
No worries.
Roundtable microphone.
Wonderful, I love it. Okay. Thank you, Ash. Thank you, Dr. Traxler. Thank you, Ruth. And thank you, Governor Walz and Lieutenant Governor Flanagan. Hi, my name is Christy Hutchinson, and I am the Senior Health Center Manager at our Uptown Health Center. Patients are coming from all over to see us at Uptown. While most patients are still from the Midwest, for the first time ever, we are seeing patients from states like Texas and Florida. We recently finished a health center expansion to increase our capacity in Uptown and meet these patients' needs. We added 7 new exam rooms, and we're increasing our abortion appointments from 2 days a week to 3 days a week, and this makes a 50% increase in capacity at our Uptown location. As we're adding options to our schedule, we're also being mindful of how the new appointment times can help patients who can't afford to take time off of work, who don't have access to childcare, and need alternative appointment options to get the care that they deserve. We've also been able to expand who provides abortion care to include advanced practitioners because of the court striking down anti-abortion laws and then the legislature taking them off the books. This has really helped us meet the moment post-Roe. Our staff are so proud to do this work and to provide a wide range of expert sexual and reproductive health care like STI testing and treatment, birth control, mental health screenings, and gender-affirming care. We're committed to providing the essential care that patients need no matter what. I know personally how important that is. I started volunteering for Planned Parenthood when I was 18, and then shortly after, I unexpectedly lost my health insurance. And so I turned to Planned Parenthood to continue receiving my pap smears, my birth control, and the other services that I needed to control my future. I would not be where I am today without Planned Parenthood. So at my appointments, I experienced an empowering version of healthcare. I was given opportunities to ask for STI testing and other services that I needed in a way that made me feel like I had control. I could see how my providers entered each appointment with a comprehensive reproductive healthcare lens, and they did what they could to make sure that I felt comfortable, and they did it while destigmatizing the care that I was receiving. As Ruth mentioned, though, there is still work to be done to address healthcare disparities, even in Minnesota. In a post-Roe world, it's harder for patients to access equitable care. And we're working on leading the way. We're working on healing the communities that have been disproportionately harmed by bad policy and inequitable healthcare. We're well aware that communities of color are not always treated well in healthcare settings, and we are trying to change that experience. One of the ways in which we're doing this is we're implementing a trauma-informed care model, assuming that every person who comes into the clinic has experienced some form of trauma, or at the very least, we will not be a source of trauma for patients. This involves small changes like asking before you touch a patient, offering a self-swab over a speculum exam. It is a conscious effort to make sure that there are options for people who don't feel powerful in the health center environment. One moment particularly stands out for me that really drives this point home, why this is needed. We had a Black patient who came in for an abortion and ended up also being seen in family planning services with us. She shared with me that the experience she had at Planned Parenthood was a healing experience for her because it was unbiased and she felt safe with us. I felt so empowered as a patient at Planned Parenthood, so it was wonderful now as a health center manager to hear a patient say that it was healing for them. This work, especially in a post-Roe landscape, is hard, but it's these moments where I am reminded that we are helping people live healthy lives, where we are building back trust between patients and healthcare, that make me proud to do this work every single day. Thank you.
We'll now open it up for a few questions.
We'll switch to a podium for Q&A. Yeah.
You don't have to move the mics.
Thank you.
Great, honestly. And you're right. You have to get creative sometimes when you're narrating patient care.
Yep.
Back as well.
Go for it.
Thank you.
Uh-oh.
Sorry.
It's not mine.
Okay, and you're welcome to stand up next to him for a Q&A.
Okay.
Yeah.
Slide this back? Yeah. Correct. Some of these people are going to get just profile.
Try not to touch them or bump them. Those good? You want further back? You good? You good? All right, we're ready. Careful. There you go. Well, once again, I'm going to give my deep, sincere thanks and gratitude. The gratitude, Lieutenant Governor was talking about gratitude. We live in Minnesota and have these dedicated folks. Listening to Ruth, Dr. Traskler, Ash, and Christy share stories of real people. This is not some weird, mean political ideology you're trying to force on people. These are people's lives and healthcare decisions that need to be made by them and their healthcare providers. in a setting that they can feel safe, respected, and heard. I'm proud that Minnesota, and I'm proud of our legislative allies, along with Planned Parenthood and all the other numerous, and I may note, the vast majority of Minnesotans and Americans who believe in exactly what's being said here today. And in light of the horrendous decision made in Idaho, that, to be quite honest with you, 2 years ago, I couldn't have imagined that happening anywhere on the planet, let alone in the United States. And that's the reality we're facing. So listening to Planned Parenthood talk about the expansion, the numbers, and just to be clear, healthcare access is hard enough without having to add these layers on top of it. And what you're hearing is, and you're seeing is, states like Idaho, they're just not going to have any providers. And that's what's going to fall upon women then to be put in those incredibly dangerous situations. So here in Minnesota, we will continue to advocate. We'll continue to work with our partners. And again, just an opportunity to start this new year on what would have been the 51st anniversary and on the 1-year anniversary of the PRO Act. Minnesota will remain that island of decency and access for health care. With that, we'd all take a few questions.
What does that next step look like? What more policy needs to be approved?
Well, I think we're here today to just hear from these providers and to talk. And again, we are proactive in Minnesota of moving forward, but we're going to have to recognize we're going to have to be reactive to horrific decisions that were made. We don't know about medical abortion services of what will happen. And with the Supreme Court's at least stay on in Idaho, it's concerning of what's next. I think for us is to watch the lay of land. I would just note, though, to stay in the lane, make sure that we have adequate services and funding for Planned Parenthood and those providers, and making sure we continue to advocate and enforce what we already have.
Speaker, most important, was talking about a possible constitutional amendment on the ballot this fall or November for abortion rights. Is that something that's going to happen? Is that something that all you support? Is it something that you think you folks think is needed?
Well, I would let the legislature will, and Speaker Hortman will bring forward on that. I do think, I just had the opportunity, my daughter's living in Montana, and one of the things that Montana is somewhat of an outlier out in that part of the country is they have strong constitutional protections. That's the only thing standing between them being Idaho. And so I think making sure we have the strength in place, making sure we continue to firewall, I'm certainly open to if the legislature determines that's the best route.
Can I hear from Representative, former Representative Richardson, as well as these people who are
Well, much like anything at the legislature, you never sort of know what's going to happen until it is over. But I think that we have seen nationally that the trend towards putting this to the people, we win, just as Governor Walz has said. Here, no different. The majority of people support access to abortion care.
Would it be necessary, or is it just an effort to drive up the vote?
You'll be shocked that I'm simply going to associate myself with the remarks of my colleagues here. But I do think the reality is, right, and certainly after what we saw in Idaho, that this is a fight that we have to keep fighting. And the very fact that we need to advocate for our own freedom to control our destiny, our own future, is something that I certainly didn't think I would have to fight, let alone my daughter. So there are a lot of tools in our toolbox. We've been very intentional about using a lot of those tools, and we'll continue to work together with our partners in the legislature to see what tools meet the moment. But make no mistake that Minnesota will continue to fight to ensure that people have access to gender-affirming care, to abortion care, and reproductive health care overall.
What a constitutional amendment can kind of safeguard to ensure that a potential future Republican-controlled government couldn't overturn things like the PRO Act?
Yeah, well, they've got 3 years of us, no matter what, for sure. So that's not going to happen. But yeah, I think that's probably the thinking behind it. And I will have to say, in looking and have the legal folks talk to us, we have the firewalls built up. We removed really harmful pieces of legislation this last time. But I am very cognizant of this. For several years before we had a majority that understood this, we were operating on an executive order on conversion therapy, and that is not the way to go, to make sure. So that was codified into law. So I do think maybe it is, and I think Montana might be the example of this. No matter how hard they're trying to reverse reproductive rights there, the Constitution is standing in their way. But again, given enough folks out there, they may try and overturn their constitutional amendment. I think it's more important that we keep this at the forefront of people's minds. We make sure the public is active. We make sure that there's just not something you're going to bring up. But we'll certainly explore it when it comes forward.
Do you think that the ERA would cover both gender-affirming care and abortion care?
I don't have enough knowledge on that one to be able to say. I certainly have spoken about the support for the ERA that we have, but that may be something.
Could one of the providers talk about the changes you've seen over the last few months since the PRO Act took effect and just the increase in demand you've seen in patients?
Yeah, certainly. I think that goes hand in hand also with some of the restrictions we've seen that have happened across the United States and really very intimately close to us around our region. And so what we have seen is a significant increase in the number of abortions being provided in Minnesota, as Ruth spoke to, that 25% increase. And so that was expected. We were planning for that. We expanded our services right after, a little bit before the Dobbs decision and definitely right after the Dobbs decision. What we have also seen is an increase in the number of abortions in the second trimester, and that is because anytime you put a barrier in front of patients, it just takes them that much longer in order to access care. So when you're talking about traveling over 800 miles, that takes logistics, that takes money, it takes resources, it takes time off work, and it takes childcare. And so, getting all of those resources together takes a little bit longer, so we've seen that. And what we have also seen in the state of Minnesota is that because we live in such a supportive environment and we have so much support from our wonderful colleagues standing here with us, that we have expanded the number of abortion providers in Minnesota. And while we've seen this increase in the total number of abortions being provided, that has not solely fallen on Planned Parenthood. We have a really supportive community, and that is what is demonstrated when you have a supportive political environment, that providers and organizations feel really comfortable providing that care because they know that they are protected. And so we've seen a huge expansion in the number of people who provide abortions in the state of Minnesota. So that's primarily what we have seen.
Dr. Drexler, or I guess anyone that could weigh in on this, can you talk a little bit about the trends that we've seen in border communities, perhaps like Moorhead? Obviously the metro has its own trends, but those areas are unique.
Yeah. Very similar. I don't know if any of you know, but post-Dobbs, there was an independent abortion provider in Fargo. Shortly after the Dobbs decision, they moved across the border to Moorhead, knowing that Minnesota was going to support the care that they provide. They have seen, from what I understand, I can't speak for them, absolutely an increase in number of patients coming to them. And part of what we have been trying to do with our Mankato Health Center is expand abortion in southern Minnesota because we are anticipating a bad outcome in Iowa. And so we will anticipate that patients from Iowa, at least some of them, will come to southern Minnesota for that care.
Two more on or off. Governor, do you see abortion being on the ballot in November, either nationally or in Minnesota?
Yeah, we've heard it. They obviously will continue to, and the push for a national abortion ban and a push to try and overturn these things, it absolutely will. We'll know that folks will try and lay a little low and not bring it up because they know that the vast majority of Minnesotans don't agree with them. But yeah, I'll continue to talk about it because they've made very clear. The Maya Angelou quote was, when somebody tells you who they are, believe them. I believe them. I know exactly what they're going to do, and as Ash said, they're going to expand it into a cruel attack on folks just trying to be them authentic selves. And so, yeah, it will definitely be on the ballot, and they will definitely lose on that issue. And so we'll keep talking about it.
Governor, Ruth's is in this new role, and it's an interesting role where there's some very different states. And I'm curious what you see as Ruth's bigger picture role coming into this right in the thick of things.
Well, I would first of all say whatever job Ruth's doing, I'm with it because I have seen her ability to do this. I want to be very careful here because of of shifting from a legislative position into this advocacy position, that she has certain things that she cannot do, certain parameters on that. But what she can do is advocate for patients, advocate for healthcare, advocate for her providers, and advocate for the things that make life better for those folks. And I think having someone who, again, just to be very clear, someone who understands the limitations of the legislature, but also the possibilities. And I think what we've seen is, and I'm just going to say it, I think Ruth's ability to see this, we didn't get this done just because of the legislature. We got it done from decades of advocacy on the ground that then led to a majority of folks who came from that world of advocacy. So I think there are many ways to serve, and I think Ruth has chosen, I want to speak for you, has chosen a place where she believes she can make a biggest impact on the differences in people's lives. So.
Can I pump up Ruth for a minute?
Yes, of course. It's one of our favorite things.
Yes, yeah, great. So I would say this. I have watched as a colleague of Ruth Richardson's in the legislature, her be an incredibly effective advocate, and have watched her move and change hearts and minds of people who may not have been aligned with her. The other thing that I would say is that as we are in this moment where we see, in particular, for Black and Indigenous women, people of color, LGBTQ plus, Two-Spirit folks from communities of color, Indigenous folks, being very clear about those disparities and the responsibility that we have to closing those gaps. I think that is part of Ruth's leadership. But her identity is also critical for people seeing themselves reflected in this organization and in this work as a whole to ensure that people have access, but that we feel as though, and I think that's why the work, frankly, that Ash does is so important, that there's someone from the East African community who can see Ash in this role. It's the same thing that people from the community can see Ruth in this role and know that this is a place for them where they can access care in a way that is supportive and affirming. And my hope is that because we see people, like, representation matters, that is also just a key strategy in closing those gaps, because in our communities, we talk about it, right? And so then we know this is a place where we can go, and that is just, frankly, that is what Ruth's leadership embodies, whether she's at Planned Parenthood or Wayside House or in the legislature. It's simply who she is. And she's a really humble person, so the fact that I just got to talk about how great she was, and so did the governor, is really fun for us.
It's a great Minnesota thing. It counts because we did it. So.
That's right.
No, one more?
Can I just ask Representative, Planned Parenthood President, do you expect the increase from out-of-state demand to continue to increase, and do you have the resources available? Do you expect to have the continuing resources available to provide that help?
Yeah, it's such an important question, because as we see the numbers of abortion bans increasing, that has a definite impact, right? And recognizing that even before Roe, there were a number of challenges within the healthcare landscape, and particularly the nonprofit healthcare landscape overall. I think there's sort of two parts to that question, though, too, because what we have seen in sort of this state of confusion, people don't even know what healthcare that they can receive in their states. Mm-hmm. And so what we are seeing, in addition to people who are traveling from banned states like Florida and Texas, we also have people traveling from states where abortion is legal because they don't know whether they can legally access abortion care. Because as they see all the legislation coming through and as they see things happening in the media, people are afraid, and providers are as well. And so as long as this trend continues, I think we're going to see more folks traveling across state lines in order to receive abortion care.
Do you have the resources to handle that expansion? Are you getting more donations or more funding?
Yeah, I think in terms of the strain on resources, we're having the same experience that all nonprofit healthcare is having right now within this moment. And so that is definitely a focus because we also recognize that even on a good day, the fact is that so many people who come to us for services, they don't necessarily have access to insurance, and we are oftentimes having to help support individuals that are in need of care, because abortion bans don't ban abortions for everyone. They only ban abortions for people who don't have the means and opportunity to travel. So many of the folks who are coming here for care need that additional assistance, and we also need additional assistance to be able to continue to provide the level of care that we provide.
Great. Thanks, folks.
Thank you.
Dr. Traxler, thanks again.
Yes, thank you for
Yeah,
coming.
Chrissy, nice to meet you, and thank you for your work. Ash, thank you for your advocacy. Pleasure to meet you. Thank you.
Oh, I was like, Governor's coming back.
Well, I'm gonna wear it if I can. I'm taking them. They're fabulous.
It's got pockets.
I know, I love pockets are cute.
Doing all right for yourself.
I'm so glad you're here. This is the first time we've met.
Sorry, thank you. And they've got to grab these. Heck yeah. Hey. Taking this here, right here.
I wore my freezer from workout. I have one that has that's a magnet, so it's just sitting through, but I can't find the back of the magnet. One of those really like industrial strength ones. Oh, yeah, it will never come off again.